Sickle cell disease (SCD) is a genetic blood disorder characterized by the production of abnormal hemoglobin, known as hemoglobin S. This condition leads to the distortion of red blood cells into a sickle crescent shape, which can cause various complications due to the cell's reduced ability to transport oxygen effectively. Overview. Type: genetic blood disorder. Genetics: caused by a mutation in the HBB gene on chromosome 11, leading to the production of abnormal hemoglobin. Inheritance: autosomal recessive pattern. Both parents must carry the sickle cell trait for a child to have the disease. Symptoms of sickle cell disease typically appear in early childhood and can vary significantly among individuals. Common symptoms include anemia, due to the rapid breakdown of sickle cells, which have a shorter lifespan than normal red blood cells, about 10 to 20 days compared to 120 days. Symptoms of anemia may include fatigue, weakness, and pallor. Pain crises: sickle cell crises, episodes of severe pain resulting from the blockage of blood flow in small blood vessels due to sickled cells. These can occur in the chest, abdomen, joints, and bones. Swelling, particularly in the hands and feet, known as dactylitis, due to blocked blood flow. Frequent infections: the spleen, which helps fight infections, can become damaged from repeated sickling, leading to increased susceptibility to infections. Delayed growth, in children and adolescents due to chronic anemia and nutrient deficiencies. Vision problems: damage to the blood vessels in the eyes can lead to vision issues. Jaundice, yellowing of the skin and eyes caused by increased breakdown of red blood cells. Types of sickle cell disease: sickle cell anemia (HBSS), the most common and severe form, where the individual has two sickle cell genes. Sickle hemoglobin C disease (HBSC), a milder form resulting from one sickle cell gene and one hemoglobin C gene. Sickle beta plus thalassemia, the combination of sickle cell and beta thalassemia genes, leading to varying severity of symptoms. Sickle beta 0 thalassemia, another variant with more severe symptoms due to a lack of normal hemoglobin production. Diagnosis of sickle cell disease typically involves newborn screening, routine testing shortly after birth to identify hemoglobin disorders. Blood tests: hemoglobin electrophoresis. This test separates different types of hemoglobin to confirm the presence of hemoglobin S and other variants. Complete blood count (CBC) to assess anemia and other blood parameters. Genetic testing, to identify mutations in the HBB gene, particularly in cases where there is a family history. Treatment: while there is currently no universal cure for sickle cell disease, various treatments can help manage symptoms and reduce complications. Pain management: pain relief through over-the-counter pain medications or prescription opioids during pain crises. Hydroxyurea, the medication that can help reduce the frequency of pain crises and the need for blood transfusions by increasing the production of fetal hemoglobin HbF, which does not sickle. Blood transfusions: regular transfusions may be necessary for individuals with severe anemia or to prevent complications like stroke. Folic acid supplements, to support red blood cell production. Vaccinations and antibiotics, to prevent infections, particularly in young children, as they are more susceptible to infections like pneumonia. Bone marrow or stem cell transplantation, the only potential cure for sickle cell disease, though it is not widely available and carries significant risks. It is most effective when performed in children with severe disease. Gene therapy: emerging treatments targeting the genetic cause of sickle cell disease are under investigation and show promise. Complications: sickle cell disease can lead to several serious complications, including acute chest syndrome, a life-threatening condition characterized by chest pain, fever, and respiratory symptoms due to blocked blood flow in the lungs. Stroke, due to reduced blood flow to the brain from sickled cells blocking blood vessels. Organ damage: chronic reduced blood flow can damage organs, particularly the spleen, liver, kidneys, and lungs. Pulmonary hypertension, high blood pressure in the lungs can develop as a chronic complication. Leg ulcers, chronic skin sores due to poor circulation. Prognosis. The prognosis for individuals with sickle cell disease has improved significantly due to advances in medical care, with many patients living into their 40s, 50s, or beyond. However, life expectancy may still be reduced compared to the general population, and ongoing management of symptoms and complications is necessary. Prevention and management. Preventive measures and lifestyle adjustments can help manage sickle cell disease. Stay hydrated. Adequate fluid intake can help prevent sickling. Avoid temperature extremes. Both cold and heat can trigger pain crises. Regular medical care. Routine check UPS with a healthcare provider specializing in sickle cell disease for monitoring and management. Healthy lifestyle. Balanced diet, regular exercise, and avoiding smoking and alcohol can contribute to overall health. Conclusion. Sickle cell disease is a complex genetic condition that requires comprehensive care and management to minimize symptoms and complications. Education and awareness about the disease are vital for patients and their families to navigate its challenges effectively. Ongoing research continues to explore new treatments and potential cures for this disorder.